The next speaker الأستاذ دكتور عبدالله المطري رئيس جامعه قبلة استشاري أول قراءة عامة. Comparison of different rapid screening tests and ELISA for HPV, HCV and HIV among healthy blood donors and recipients in Jibla University Hospital, Yemen.
السلام عليكم. طبعا الوقت قصير وانا بحاول بس اعطيكم مثل الهوم مسج. اوكي، هذه الدراسه اجريت عندنا في مستشفى جبلة الجامعي على 400 شخص، وهي مهمه جدا for anybody work in surgery particular, okay, or in delivery. It is about the false positive and false negative for doing the test for hepatitis B and C and HIV by traditional methods using rapid test and how to use the ELISA or anything like ELISA test like COBAS in order to detect the viruses. Okay, our study ليش ما يتحرك؟ هذه جبلة يونيفرسيتي. وين ليش ما يتحرك الوقت بيروح؟ Okay, so this study is blood transfusion services are an important part of the health system all over the world. Worldwide, transfusion transmitted infectious disease remain a major health problem in most developing countries due to facilities with scale risks and shortage of the staff members. Blood donors, viruses infections are most problems in blood transfusion. As you know, these main three diseases can be transmitted whether to the staff workers or to the patient during blood transfusion. Okay. There are two important strategies in order to do success of blood transfusion. The first one is the adaptation of the national blood transfusion policy to select the donors. All over the world, not everyone will come to do donation. They make screen and they will, yes, you can donate or you cannot since the beginning. So to select the donor, which aims to exclude donors with a higher risk of infections such as hepatitis B, C, and HIV. Second strategy is to application of methods with high specificity and sensitivity for identifying true positive and true negative individuals. So this is the second important strategy. Different methods are used, as I said, for diagnosis. Viral includes enzymes-linked immune sorbent assay or enzyme immunoassay or polymerase chain reactions and immunochromatography method. This is the right methods. One of these methods is the right method. A diagnostic method used by ELISA, where we use the ELISA as control group. But they are using the rapid test, which is in most of the undeveloped countries, they are using just for screening. Okay. We used 4 companies in which they are present in the country for the study. The need for blood tests to detect the hepatitis B, C, and HIV of the population in Yemen, according to the direction of the Ministry of Health, which mandate this test before operations and during certain medical services like deliveries, blood transfusion, organs transplantation, and such. طبعا the study, we use 400 patients, 300 of them they were a male, and most of them they are donors, and around 100 female, and mostly they are recipients. For each one, we did for them a test from the 4 rapid test companies present in Yemen, and even by ELISA test. طبعا the results of positive and negative samples performed with rapid test for screening of these test results, dual infection with hepatitis B and V were excluded. Any patient which they have both of them excluded. Data was analyzed by SPSS. Total of 400 blood donors are used. طبعا 5% from all the population they were having positive for the 3 diseases, but they were negative with ELISA. That means it is very high ratio, 5%. Okay, some of them they were having negative hepatitis B or C or HIV. Some of them they were positive by ELISA. So the risk is 5% of the population. The results, furthermore, there is 15 by intake. This is one of the company, and 10 by SD, and 11 by upon, and 10 by clone samples were positive in the other hands. The 5% what I said they were negative, but many of them they are positive. But when they are positive and they are by ELISA negative, there is no problem. Okay, but the problem is in the vice versa. Okay. When in HIV, 2 cases were detected by ELISA and 2 cases detected by each of the 4 rapid tests. This is the, it can show for each company and each relation with the gram positive, gram negative in the 3 problems or diseases. طبعا the most important problem with the analysis by the rapid test is the low sensitivity. Most of the sensitivity was okay, but the specificity, but the sensitivity is the more problematic issue. Conclusion, this study showed a significant differences in sensitivity between ELISA and the rapid diagnostic immunochromatography techniques. For the intake group, the sensitivity to being, in general, the sensitivity, it is low, between 25% up to 75%. So it is very big defect in the sensitivity. Okay? This is for each company. The degree in the sensitivity of the rapid diagnostic test proves that methods is not suitable for quality testing of the infectious markers for blood donors at our hospitals. My home message for anyone working as a surgeons or even other medical personnel, we should deal with each patient as if it is positive. We should take the tricks how to do with all the patients as if they are positive. Thank you.
شكرا دكتور عبد الله، ألف شكر.